drug prescription and the dosage calculation, and these are objectives: definition of drug prescription and the dose calculation, component of drug prescription, and now how to calculate drug or medicine dosage. Starting with the definition. Drug prescription, it's sometimes known as drug order. It's an instruction written by a medical practitioner that authorizes a patient to be issued with a medicine or treatment. So here, the key term is an instruction that is written by a medical practitioner to authorize now the safety uses of a medicine or drug for effective treatment. Drug dosage calculation is a method of calculating medication or drug doses. The drug quantities of medicine are not always indicated on the prescription. So when the drug is on the prescription, it doesn't indicate the amount that you should give to the person, or the amount of the prescription and the amount of the drug in which it is prepared maybe are not equivalent, that you should give direct. For example, you might have a tablet of 500 milligrams, but you are told to give 1000 milligrams. So you must calculate now to have that, what amount you should give so that to have that prescribed dose. Here are the components of a prescription. So a proper prescription must have all of these contents. It should have date and time of the order is written. So the date and the time is very essential, in which the prescription is written. A drug name, a generic name preferred, or scientific names. Last time we discussed, I said the drug are in different forms. There are different names of drugs. We have anonymous names, generic names, approved names. So trade names, the most important is generic name, because the generic name doesn't change, but the other names may change from country to country or from one manufacturer to another, but the generic name remains the same. So in any prescription, a generic name is preferred. The drug dose, now this is the amount of drug that is going to be administered. The frequency and duration of administration. When we say frequency, we say how often the drug is going to be taken. If it's one time a day, 2 times, 3 times, or once, or when necessary. The duration, now the time that's going to be taken, if it's 2 days or 3 days or 24 hours, etc. And any special instruction for withholding or adjusting a dose. This is also should be included in the prescription, that at the time you need to increase the dose or subside the dose or withhold. Physician or other healthcare provider signatures the name. Now the prescriber, the health personnel who prescribe this medication, should include his name, signature, and the license number of the prescriber. So, and let's must check on the following in a prescription before dispensing a medicine. The first one, check medication order is complete and eligible, depending on now considering these components of the prescription, so it should be legal. No general purpose or action, dose, and the route of a drug. It's also important for a nurse to compare the drug card with the drug label 3 times. So you should be sure of the drug card with the label of the drug. You must have the card, but inside the drug is different. So when you are opening the drug, you should be sure that it is the same as the card is labeled. At the time of contact with drug bottle or container, before pouring a drug and after pouring a drug, so these are very necessary to check before. So these are most of the abbreviations that are used in the prescription. We have OD, OQD. This means once daily, that you take the drug one time in 24 hours. If you take it now, you count 24 hours, then you take. So once a day, OD. BID means twice a day, 2 times a day. TDS or TID, this is 3 times a day or 80 hours, because a day has 24 hours. If you divide by 3, you get 80 hours at the interval of 80 hours. 4 times daily is indicated by an abbreviation of QID or QD. 4 hours means 6 hours at the interval of 6 hours. NOCT, this may indicate that if you found NOCT, the drug have to be taken during the night. PO is an abbreviation for medication that have to be taken per oral route. IM, intramuscular injection. IV, intravenous injection through the direct into the circulation. SEC, subcutaneous injection. PR, parectum. The drug now had to be given through parectum. AC, before meal. Now the drug that have to be given before meal. PC means after meal. You take a drug after meal. And PRN indicate a drug. You take a drug as required. Where necessary, you don't take it at any time. The good example are the anti-pain medication. They are not given routinely, but you give the drug when your patient is in pain. So it is 1 time a day. So this is an example of a prescription. For example, paracetamol. This is a name of a drug. A name of a drug which is generic. This is the dose. The desired dose to be given to the patient, 500 milligram. PO, this is the route. The route now for the drug to be prescribed. The route. TDS, this is the frequency of the drug to be taken. This is 3 times a day. And we have, this is the duration, 3/7. That means the drug has to be taken 3 out of 7 days. So if you find the denominator here is 7, that the drug, these are the days. So 3 days. The same name of drug, the dose, route, frequency, duration. Name of a drug, metronidazole. Dose 500 milligram. Route, it's IV. Frequency, it's TDS. There's an error here. This is TDS for 5 days. It's the same applied to folic acid here. Calculation of drug dosage. So It is the responsibility of the dispenser to calculate the required amount of the drug to be dispensed. The quantity expressed in various ways, and it often depends on the type of the drug that has been prescribed in different forms. So the quantity of drug here are expressed in various ways. The other expressed as weight, for example, maybe 550 milligram, 5 gram, etc. There are the drugs that are in volume. Are in volume, so maybe 5 ml, 50 ml, 300 ml. But they are also as number of units. For example, tablets, maybe 40 tablets or 20 caps. This is for the drugs that are in solid form. Number of original packs, maybe boxes. Other drug being packed in a unit which contain a full course of treatment for 1 week or 4 weeks, such as ARV or the anti-malaria medication. You find them in the pack for the whole dose. The quantity of a drug to be calculated is often based on the duration and the daily dosage. So, duration of treatment may be indicated in days. It can be in days. I say if you find the denominator is 7, so it is found there is 5/7. 7 is the denominator. It is for 5 days. It is out of 7 days in a week. If you find the denominator is 52, here they are weeks because the year has about 52 weeks. So if you find the denominator is 52, these are the weeks. So the drug will be taken it for 2 weeks out of 52 weeks in 1 year. Then 2 weeks means 14 days. Then if you find 12 at the denominator, these are the months, because the year has about 12 months. So 1 month out of 12 months is in a year. So let's now look how to calculate the dose for tablets and capsule. So we have the formula. This is guided by the formula. The formula is said the desired dose or amount of dose is equal to ordered dose over amount on hand times the quantity of drug, that we say X as the desired dose is equal to D over H times Q, D being the dose ordered, H amount on hand, and Q the quantity. Let's look here. So to calculate how much of the drug should be supplied, the following is used. First one, number of tablets or capsules to be taken at each dose times number of the day times the number of days to be taken. This is it to have the total number of tablets that can be taken for the whole dose. But ensure all measurement are in the same system of measurement and the same size unit measurement. If not, convert before proceeding. Let's look at an example here. A prescription reads paracetamol tablets or 1000 milligram TID daily for 5 days. So the prescription is paracetamol tablets. The dose is 1,000 milligram to be given 3 times a day for 5 days. Now you have to calculate the desired dose or amount of dose to be given to a patient, and calculate the total amount to be dispensed to the patient. Paracetamol tablets of about 500 milligram are available in your pharmacy. So here what you have to do is to identify now. This is the desired dose, is the D that we are given as the desired dose is 1,000 milligram. Then the amount in hand this one 500, that is the amount you have, the unit of measure that you have in your pharmacy, that each paracetamol tablet you have had 5 milligram, and the quantity will be 1. So now you can calculate. So from there, with the same formula, D over HQ, X is the desired dose, the prescribed one. This one, paracetamol tablets, 1000 milligram. This one here, the dose ordered, it will be 1000 milligram. Then the amount in hand, that you have one paracetamol tablet of 500 milligram. This will be your H, 500 milligram, and quantity, that means each paracetamol tablet you have, that one tablet here, this is your quantity. So the quantity will be 1. Then you solve for X, which is the desired dose. You take 1000 milligram over 500 milligram times 1, you will have 2 tablets. So therefore 2 tablets should be given 3 times a day for 5 consecutive days. So now, to have those amount of dose that is required, you will be required to give 2 tablets, because if each tablet have 500 milligrams, so to have 1000 milligrams, you will need 2 tablets. That's what it means. From the second, calculate the total amount to be dispensed to the patient. Now, how much will you give to the patient? Total amount to be dispensed. You have the number of tablets to be given in a desired dose times number of doses in a day times number of days. Now, from our question here, that the amount is 1000 milligram, where we have calculated and found that we should give 2 tablets. Then TID, so the drug should be given in 3 days, and for 3 times in a day for 5 days. So here now we find 2 tablets to be given 3 times in a day times 5 days. If you multiply 2 times 3 times 5, you will find 30 tablets, because if day and day will cancel here. So 30 tablets should be dispensed. So for liquid, the same formula is applied, but here the volume is calculated. This is an example. A provider requested lorazepam 40 mg IV for a patient in severe alcohol withdrawal. The clinician has 2 mg per ml vials on hand. How many milliliters should he or she draw up in a scene to deliver the desired dose? Here now the same formula will be applied. The same formula will be applied, which is X is equal to D over HQ, D being the desired, the ordered dose, H the amount in hand, and the Q. So D ordered dose, the ordered dose here is 4 milligram. That is the ordered dose, 4 milligram. Amount in hand. Amount in hand, you have vials of 2 milligram per ml. So each ampule that you have, that 1 ml is equivalent to 2 milligrams. So this will be your H. Amount on hand is 2 milligram, and the quantity now will be 1 ml, because this is 2 milligram per 1 ml. That will be your Q. So in your calculation now you will have 4 milligram over 2 milligram times 1 ml. Milligram will cancel. You will end up with finding 2 ml. So 2 ml should be drawn up in a syringe to deliver the desired dose. Alternatively, Alternatively, you can do that. If 2 mils is equivalent, if 2 milligrams are in 1 mils, if I want to give 4 mils, how much will I give? So you find it to cross multiplication. You will have sort of 4 milligrams times 1 over 2. You will get the same answer, 2 mils, as indicated there. So it's very important to know when you're calculating the dose, the unit of measurements must match, should be the same. Example, milliliters and milliliters. If they are not in the same unit, you have to convert. So in the example even we have checked before, the ordered dose was in milligram, and we have dose was in, and we have dose was in milligram. So both will cancel out, leaving milliliters. So further conversion was not required because all were in milligram. Maybe if they maybe this is in milligram and this was in gram, you should have required to change them into 1 unit of measurement. So you can pass through the slides. Also, you can pass through the reference books, the facilitator guide that I have sent to you. If you have a question, you can ask, but I encourage you to have more practice, and I will give you more questions for practice. Thank you.